Hello, everybody, and welcome to the show. Well, I'm very happy today to have a healthcare CEO on the show with me today. His name is Dr. Baktari, and we chatted a few before I hit record, like I always do. And then I'm always like, I wish I was recording right now because most of the juice happens before I hit record. So we're going to try to continue the juice flow throughout this show. I have been listening to Dr. Baktari's podcast, which is in the show notes. So I highly recommend that you all follow. And if you are like me and have the attention span of a flea, you can go and get a bunch of clips from his wonderful Instagram page and learn more about all of the things and all of the knowledge. Any question you want answered actually about COVID-19 right now, pretty sure you can get in 10 minutes on 1-minute clips on his Instagram page. Is that correct?
Okay. Thank you. Yes, we try to make it simple.
And keeping it simple is really what we need. So I really would like to know, because my interest is always about the story of who somebody is. So I realize that you are a physician, former triple board certified internal med, pulmonology, critical care, big deal. I'm just kidding, of course. It only took years off of your life to get that. But who are you? Where were you born? You have a family? Where do you live?
Yeah, well, we'll work backwards. I live in Las Vegas. I have a family. I have 3 beautiful boys, wonderful family, wonderful wife. And then I actually grew up in Chicago. So grew up in Chicago and then really left Chicago for my education. Wound up going to Case Western Reserve University for my undergraduate degree in biology and psychology. Then I went to medical school at Ohio State, Big Ten school in Columbus, small little Big Ten school, and then made my way to Northwestern University for my internal medicine residency in Chicago. And then finally went to UCLA to do my fellowship in pulmonary and critical care. So kind of worked my way west for my education. And then pretty much a little bit right after that, after I finished UCLA, made my way to Las Vegas a year or 2 later, and been here since.
So how many years is that now that you've been in Vegas?
It's 20 years plus, yeah.
Beautiful. It turns out that there is more to do in Vegas than go to casinos on the Strip, just like there's more to do in New Orleans than Bourbon Street that I just found out after going to a wedding. Okay, I'm sure there are beautiful places in Louisiana. Bourbon Street was all I seemed to fall into because of the wedding I attended. But I'm really, really excited to talk to you because as I've had the great pleasure of working with and interviewing so many physicians on the show, there aren't many that, what I like to say, break out of corporate and decide to blend their medical background along with their entrepreneurial bug and move out and step out in faith and try something that really, ignites a passion inside of you. So why don't you tell me a little bit about how you decided to go from, my goodness, internal med, pulmonary, critical care to what you're doing now?
Yeah, I think, part of it was always getting to the next level. When you were in med school, I got to get into internal medicine. And when you get into I got to really get into pulmonary and got to get into critical care. And then, I got to get a job. I joined a group. Well, I'm a junior partner. I got to become a senior partner. And there was always like the next thing. And then once you get to senior partner, for a person who's always trying to look for the next step, it kind of seemed anticlimactic. Especially after a few years of being a senior partner, you're like, if you're the kind of person always looking for the next challenge. So then I said, well, why don't I just do some administrative medicine and just get on a committee here? And next thing I was chairman of internal medicine. So you did that. And then somebody said, hey, we have a position on a committee at Blue Cross. Would you mind being on that? And it was always one door opening the next door. Next, then I was medical director for Anthem Blue Cross Blue Shield for the state of Nevada. And then that opened up another door at another insurance company. And then I got the opportunity to be medical directors at hospitals. And And then I also got an opportunity to do clinical faculty at medical school. So I was on the clinical side, the teaching side, the hospital administrative side, and then of course the insurance side. And that really laid the groundwork for understanding everything that's right and everything that's wrong,
Yes.
with the medical system. So it was an evolution by being on the teaching, clinical, hospital, insurance side. Very few people are fortunate enough to be in all four of those pillars. So when they come at solving the problem, they have all four perspectives. So I like to think that helped us understand what we had to do to really create a new space, a new way of doing things.
Yeah, I love that. I think, it took a long time for me to be in business on my own to realize that my true goal as the Doctor Whisperer is really just to improve patient care.
Right.
But it didn't start out that way. I've always been very business minded, and coming from New York and growing up and having this eye-opening education in what medicine can look like, what it should look like, and then realizing, how physicians, you spend so much time in school, and then most doctors, when they leave school, they're either entering a hospital setting or a very large practice. And like you said, then, you go the partner route, and there are so many doctors out there that do want to continue that climb. And it's this wonderful space to be in, to want to fulfill a need to make ultimately patient care better. But in order to do that, you really do have to understand that medicine is a business.
Right.
And even though I've had many physicians through the years say, well, I don't want to have that conversation about how much money the patient owes me. Well, actually, no, you shouldn't, but right. You need to have the proper people in place. So what has it been like for you through this pandemic? Of course, I really do highly recommend. I think every question that I had still floating around, you answered on your Instagram page. So I really do recommend that. One of them being like, can I take the flu shot and the booster shot? Just little things going that you're not too sure of. So what has it been like for you through the pandemic?
Yeah, it's kind of interesting because obviously initially when it hit, everybody was concerned, my staff, and wanted to protect them, and, just understanding how, but getting past it, it was a very amazing thing because, as I told you offline, our clinics don't do primary care. We don't do urgent care. We're not seeing sick people. All we were doing prior to COVID is protecting adults, mainly by adult vaccinations and testing, and then, physicals associated with that and other services associated with that. So in many ways, it was kind of ridiculous because a lot of companies that are now COVID companies pivoted to COVID. I don't know, they were like doing, occupational medicine, or they were doing urgent care. Now they're a COVID company or whatever. We were doing this, all our software, everything, my staff, we have $10,000 vaccine refrigerators from Panasonic, which keeps the temperature equal at every part of the fridge. And we have a thing that emails us if the temperature is a half a degree off anywhere in the fridge. And, we were already doing that. We weren't pivoting. And so luckily, and all our processes, procedures, the staff training was already in place, our technology. So we launched like nationwide COVID saliva testing from home or work early on in the pandemic.
Nice.
Before anybody did. And mainly because, for whatever, that's what we were doing before it hit. And my staff, give them a lot of credit. Oh my gosh, in the span of 2 months, they all like geared up, and, we got vendors aligned, we redid, tweak technology. And our goal was not even from a business point of view, but how could we have an impact on this pandemic in a meaningful way? So people who, for example, needed testing in remote areas of the country could have access to it. We'd send them a package, they could FedEx it back, and then we had a portal, the results would show up, and and set up accounts with FedEx and this and that, and all of that. My staff, oh my gosh, they crunched a lot of hours, but if we had the backbone there to begin with,
right,
and that made it easy. So yeah, that's how we came out dealing with the pandemic.
How many staff members do you have?
Between both organizations, probably have 50. Yeah.
Nice. So another thing we were talking about offline is the wonderful power of a review. And you have 10,000 positive, of course, there's going to be a few negatives thrown in there,
right,
reviews, which is so, well, it's pretty special and rare to have all of those positive reviews. So it certainly speaks to the good work that you are doing in your business. I'm interested in knowing what you see. For me, I work with a lot of doctors that have broken out of corporate, and I have doctors that have been in telehealth years and years and years prior to the pandemic. So there was no real pivoting. You really have to have almost this entrepreneurial mindset to not plan for the now, but plan for the future. And one of the things that I've seen you do really well is to, jump on this podcasting, social media. And I've heard all of the feedback, as you can imagine. I'm sure you have too. I'm a professional, darling. I don't need to do social media, right? How do I do a podcast? Who wants to listen to me talk about, primary care or plastic surgery, whatever. So what gave you that? What was it? Some people, I opened my media company 3 years ago because I listened to Gary Vaynerchuk. And that's the truth, right? Like I thought I can do social media a heck of a lot better than what I see out there. Why wouldn't I go ahead and do that myself and add that to my business? So what was it for you?
Well, like I told you offline, we're not doing these podcasts. We're not selling anything. We're not trying to monetize it. I think I've always been an educator before. I sort of got that part of me out by being on clinical faculty at medical schools. I've been on clinical faculty at 3 medical schools. So I've taught interns, residents, fellows, medical students, nursing staff, respiratory therapists. I mean, I've been in charge of education for them, for most of my career on clinical staff in medical schools. And then within our organization, I'm very involved in education and making sure that we have quality and the staff feels comfortable doing everything. But I think this opportunity to do education and help people and promote preventative health and wellness, promote adult vaccinations, was something that we felt really strongly about. And we're probably, even though we're local in Nevada, I really think when it comes to adult vaccinations, we are the 900-pound gorilla. I mean, there's nobody that knows more about adult vaccinations than my staff. I mean, they are the powerhouse. I mean, truthfully, people, in government sometimes reach out to us and ask for clarifications on things. We really, because this is, and mind you, of course, I have an amazing staff, but something powerful happens when that's the only thing you do.
Yes, I agree.
When you're doing, if you're in urgent care and you're doing a couple of vaccinations on the side, in the corner, a few times a week, you're not a vaccine authority.
That's right.
When you don't do primary care, you don't do urgent care, you don't do occupational medicine, and all you do is focus on vaccinations. And you set up policies, procedures, technology, and training only to do adult vaccinations, you get a perspective that you can't get any other way. And so I think that puts us in a very unique position. I doubt there's anybody in the country that knows more about adult vaccinations than some of my clinical staff, for sure. I mean, they could be a world authority because they're doing it all day long, every day of the week. And so, it's a pretty kind of interesting place because we live and breathe preventative health and adult vaccination. So it puts us in a very unique perspective.
Well, now more than ever, right? Don't we need vaccine authorities to combat all of the crap that you hear? It's unfortunate. And working in this industry, I want to say so much, but sometimes I'm like, screw it. Just say it. But, I mean, I work with physicians even that have not gotten vaccinated. And and a lot of nurse practitioners, nurses, and the things that I've seen and heard. And I'm no authority. I'm not even a doctor. I'm just whispering. So I listen, and I don't really formulate too many opinions because that can get me in trouble. But I certainly would value the authorities, such as you were just mentioning, to really kind of squash some of the fear that is so pent up in so many people. And unfortunately, just in the last 2 days, a girlfriend of mine lost a family member and wasn't vaccinated for COVID. And that's happened all over the world right now. And so we need to hear more. And what you just said about being, sorry, I'm like excited about what you're saying now. So jumping in on it. What you were just saying about being great at one thing, when I go today and I see that, I won't even name a specialty, but I go for one specialty and I see that they're offering 7 other services.
Yeah, like Botox, weight loss, vitamins to lose weight, the whole shtick. It's a yeah.
And I loved, you had this one clip with, I don't know who you were speaking to, but how easy it is for people to become specialists at providing other services without actually being the specialist. Right. Does that make sense at all?
Yeah.
Can you elaborate on that?
On that point, I just think there's a lot of economic pressures on certain, groups and whatever to, expand their services, especially if it's kind of a cash paying thing like Botox and weight loss and stop smoking and vitamins and, but, I think the funny thing is, I think when most people walk into their primary care office and they see that he offers Botox, I think they get it. I think they get it like, huh? Really? Okay, Botox or derma this or derma that. I think so. I think there's an immense amount of pressure as insurance companies clamp down on reimbursements to kind of diversify. But there's a downside to that because you need training, you need staff, you need to focus, you need to understand, you need to market properly. There's a lot to know. So it's not as simple as let's just add that service on, ideally.
Yeah. I mean, and people come to me a lot for recommendations of who they should go see for different specialties. And because I know what's really going on the inside, I mean, the first time I ever got Botox, it was a pediatric nurse practitioner. Hey, listen, I don't know any kids under 8 that are getting Botox. Just saying, right? Not sure. I mean, who knows what's next, but I don't know. Yeah. So it speaks to, for sure, you really have to get more educated. The patient has to become more educated about the facility they're going to use, the doctor they're going to go to, the space where they're going to learn about vaccines. And again, we'll have all the information in the show notes about how to read up on all 10,000 of those reviews so people can get a better understanding. How have you liked being an entrepreneur, doctor?
Yeah, it's the whole thing. The grass is greener on the other side, right? When you're clinical, you're thinking, oh, look at that guy who's an entrepreneur. Like he doesn't have to deal with like seeing 20 patients a day, and his life must be so amazing because, he's not taking calls maybe, or he doesn't have work weekend. But it's always the grass is greener on the other side, because when you get on this side, you're like, whoa, there are challenges, with hiring and HR and, policies and procedures and, the cash flow and economics and what have you. So, I mean, it is definitely you have to acquire new skills.
Mhm.
There are new skill sets you have to acquire,
Yeah.
and the tuition to acquire those skills is, losing money initially, because you don't know, you don't know how to hire, you don't know, how to put economic structures in place and find a good financial people, and so you make mistakes, and I call that paying tuition.
Yeah.
To transfer out from clinical to non-clinical, you pay tuition. It doesn't seem like it's they don't call it tuition.
Right.
But you have to, for this education to, move from clinical to entrepreneurship. Yeah, there is I don't want to say you waste money, but there is a certain amount of money that you kind of blow through because you don't know what you're doing, and hopefully you catch on, and hopefully you affiliate yourself with other people who've been through it,
Right.
who can minimize the tuition.
Yes. Yes. Learn from the people that have already made those mistakes.
Right.
Ideally.
Yeah, like
Yes.
I saw on your website, to toot your horn about the front office thing and what have you. I mean, go to people like that so you don't have to go through it, and it will minimize your tuition for that transfer.
100%. It's kind of amazing how I just this morning I got a text message from a doctor that asked they want to meet with me about what are my services, how much does it cost to start a podcast? And I just I hit her with 9 questions in a row just because I needed to ask those questions, but also to overwhelm, because it's, as you have, I'm sure, seen and witnessed, by doing is really when you learn, right? You are doing the podcast, you are doing the branding, you are doing the social media, and you kind of learn as you go. And there are definitely going to be mistakes made. And certainly the team that surrounds us is absolutely 100% the most important. And you giving praise to your staff, well, that just makes me like you more. Just saying, Doc. Because really, without our team, right, we're nothing.
Yeah, when people say about those 10,000 reviews, that were truly reflection of my staff and the technology. I mean, you'll never see my name in any of those reviews. It's all, and so there's no. I'm not just being disingenuous. It really is them, because they're the ones that are making that experience amazing.
I agree 100%. Well, Doctor, we're going to have to do a part 2. Can I get you back to do a part 2?
I'd love to.
That would be awesome, because I really have too many questions running through my mind that I know that you'd be great at answering. And I've really enjoyed our time together. But as you know, most people have the attention span of a flea. So we will cater to that audience today and have you back again. But thank you for your time. And I wish you the best through the holiday season.
Same to you. Happy holidays. Thanks for having me.
Viva Las Vegas.
All right. I'm Maine.
Bye.
Bye-bye.
So don't forget, if you mention that you've seen the show or listened to it on the podcast, mention Thai Technology and you will get 3 months for free. They're the best.